It is my pleasure to welcome you to the University of Cincinnati Radiology program. Here at the University of Cincinnati, we strive to promote a culture of collaboration, inclusivity, and curiosity as we train the next generation of radiologists. You will find opportunities abound at the University of Cincinnati, whether your interests lie in leadership, education, advocacy, global health, research, informatics, 3D printing, AI, or machine learning. We have an impressively diverse set of pathology, exams, and procedures to prepare you for where you want to go with your career. The City of Cincinnati also boasts a warm, welcoming environment with top-notch schools, affordable living, and a variety of activities for families and singles alike. So please, sit back and learn more about the opportunities that await you here at the University of Cincinnati.
The department was really welcoming, the residents were all really welcoming, and I felt like there was a good camaraderie between the attendings and residents, which was really important to me. So this actually ended up being my favorite program, and I was not expecting that at all.
You know, this is the kind of place that the people you work with at all levels are the kind of people that you'd want to spend time with outside of work.
It felt very warm. I really appreciated that. I also liked that everybody sits in the same space. Other places have kind of cubicle style reading rooms where people work mostly independently. I think here everybody in the same space allows for more collaboration.
A lot of laughing, which it made me feel very comfortable here. Really just how the attendings interact with the residents, how the residents interact with the residents, how the residents interact with fellows, everyone really very friendly, very approachable.
In the reading rooms, there's a very relaxed atmosphere. Everyone is very collegial. People, they seem to enjoy themselves, and I think that's really important. And they just seem happy.
The camaraderie we have between everybody, all the residents are pretty good friends. Also the faculty, there's no one on staff that's intimidating to go talk to. If you have any questions, even if it seems like it's the dumbest question you can possibly think of, no one's going to bite your head off.
All of our faculty are extremely dedicated to teaching here. If you have any question, if you have any concerns, they're extremely approachable, and you can ask them anything and they'll be more than welcome to help you.
If you're looking for like a lot of diverse pathology, you're definitely going to get that here. They do a lot of advanced procedures, and there's a ton of trauma.
We are a level 1 trauma center. We are a tertiary care center for the area, and Cincinnati is located in the tri-state area. It's right at the border of both southern Indiana, southwest of Ohio, as well as northern Kentucky. And so we're a large feeder area for that. And then we're also a high volume transplant center. So we hit a lot of high-level academic patients who require very complex care. And so because of the combination of all that, you see just a myriad of things that will prepare you for any kind of complexity or case that you may see.
If I could do it all over again, I would definitely pick this program again.
I'm really happy with my choice. I think Cincinnati is a great place, kind of a diamond in the rough.
It pains me that the applicants can't come to our program this year, because one of the best features of our program are the people and the environment and the culture that we've created and that we foster. And it's harder to get over virtual interviews or virtual meetings, but we have a great group of residents, very supportive staff, and a great feeling of community.
One thing I'm really hoping that this will do is to let our applicants see that we're a tight, close-knit community. We prioritize the learning environment, resident development above all else. The University of Cincinnati is a great medium to large-sized program. It has a lot of diverse pathology. It's the only level 1 trauma center in the region. We have the #2 Cincinnati Children's Hospital in the country. We have affiliated private practice hospitals, as well as a VA hospital. So we really cover a wide girth of pathology that residents are able to take advantage of here. And I think, you know, for the size of our program, the exposure that residents receive to this diverse pathology is immense.
The nice part about our residency is that residents are able to rotate through all the disciplines, and then later in their residency cater to what they think they might be interested in. We have attendings that are really committed to resident education. Many attendings have spent their entire careers fostering their teaching styles and promoting resident education, both through the day-to-day side-by-side learning, but also through academic research projects and fostering the residents' individual interests.
We're a very collaborative residency. We work together in almost all aspects, and we try to work together and do things inside and outside of work to help promote this type of team building exercises.
We have an innovative program called peer-to-peer mentorship, where the residents are serving as mentors for other residents because there's always something to be learned from someone who's been through it. And we also have faculty resident mentorships that is a formalized process. Every resident is assigned to a single faculty person. Every faculty person only has one resident, so it's a very personalized one-on-one relationship that we're creating to guide the resident through the different phases of their training.
Because really, having a great mentor can make such a difference in enjoying and thriving in in the residency program.
The perfect candidate is someone who is motivated, interested in learning, realizes that we all have deficiencies, we all have weaknesses, and we're all working to be a better person and a better radiologist or physician in general. Someone who's open to really exploring radiology, but also exploring how to be the best radiologist and person they can be.
When you can enjoy the pinnacle of your training, getting up, going to work every day, then you learn so much more. And I really have tried my best to recreate that type of environment, and I think we've been very successful in that. And that's something that I really want all the applicants to understand.
I'm kind of like the mom of the program. Everybody comes to me when there's a problem and they can't get this done, or they want to ask a question about that. And of course, they always come here for candy. They have a loaded candy dish to keep their energy up during the day. I've been doing this for many, many, many years in different specialties, and I've seen a lot of my residency graduates go on to become chairmen of departments, and it is very rewarding to know that I played a role in their education and helped them to become a successful physician.
Musculoskeletal radiology program is very well rounded at the University of Cincinnati. We have a lot of educational opportunities that I think are unique in addition to regular things that we do for patients day in and day out. One of our special interests and things that we kind of enjoy the most is the care that we provide for our athletes at the University of Cincinnati. We have a sideline pass for the football games. We attend a lot of the sporting events. We directly interact with all the athletic trainers. We get all of the information clinically from both the athletes and the trainers, and being that involved in their care, we're able to be a much more interactive process, and I have learned a tremendous amount about the mechanics of sports by taking care of those athletes, and we have helped educate the trainers, and the trainers have helped educate us. And I think having that level of involvement of all of the stakeholders in the care is very important to the learning process.
UC Medical Center is such a big referral center in the region. We get a lot of trauma, and they are complicated trauma. So when you know how to read super complicated trauma, simple trauma is just going to be a piece of cake. So I think this is something that I talk to our former graduates about, is like the complexity and the number of cases here really made them a better radiologist when they graduate.
Pediatric radiology is a little different from adult radiology in that, for one, we do have fewer volume of studies, which I think really helps us to focus on the quality of the services we're providing. I think there is more patient interaction in pediatric radiology, particularly with fluoroscopy. Even in the era of COVID, we do have residents go in and scan with the technologists, so they get that hands-on experience. They will get to experience all of the subspecialties within pediatric radiology from people who are accredited as the nation's experts in their particular field at one of the largest children's hospitals in the country.
I think it's really important to see what a fantastic relationship we have with our residents. Especially in IR, we work hand in hand. The IR reading room, we're all in there. We work collaboratively. We have consults every single day, and we, do at the tabletop teaching, during the procedure teaching, post-procedure teaching, we go see the patients on the floors with the residents. So there's a lot of camaraderie within especially the IR department, but also the entire radiology department as well.
One of the courses that I've been involved with as a faculty member is the NIIC program, which is a National Radiology Informatics course. And our program is very committed to making sure our residents participate in that throughout their training program. It provides them the exposure of all the tools that we have at our daily disposal, how they came about, how to gain the maximum usability out of them. And also it is important to understand those nuances and infrastructure so that you can help your next practice, you can help your next patient in being able to adapt to the current information technology.
During breast imaging rotation, we have about 2 to 3 residents, and these are usually residents in different classes, so it might be a first-year radiology resident paired up with a senior radiology resident. During the breast rotation, they're here for approximately 1 month, so this allows them to have exposure to many different aspects of breast imaging. They can see procedures, they can be in diagnostic clinic, they can also work on reading screening mammograms, so they have a very diverse experience.
So we cover a wide range of pathology in the chest section, everything from patients with lung cancer and other intrathoracic malignancies to patients in our lung cancer screening pool, which is a large and growing population of folks who are screened for lung cancer on an annual basis. We have a lot of patients with interstitial lung disease. We have a growing cardiac section where we do a lot of CT and MRI of the heart. And of course, in this addition to some of the more acute pathology that we see, being a level 1 trauma center and so forth. So residents are going to get to experience and be involved in every step of that process. And most of the modalities that we focus on in the chest room are radiographs and CT scans, but then we also do a decent amount of MR imaging as well. As a resident, if you come to the end of your 4 years and you've seen a broad spectrum of pathology over and over again, that's going to give you the confidence that yes, I can go out there and read anything.